Hey everyone, Dr. Mike here, and welcome back to the channel. Today we're tackling a condition that can be a little embarrassing to talk about. Anal prolapse. We're talking about what happens when things down there shift a little out of place. So let's get right to it. So what exactly is anal prolapse? Imagine your rectum, the last part of your digestive tract, is like a tube. In anal prolapse, that tube starts to slide out of place, sometimes even protruding out of the anus. There are different degrees of this mucosal prolapse and full thickness prolapse. Chronic straining, weak pelvic floor muscles, and chronic diarrhea are major culprits. Neurological disorders, pregnancy and childbirth can also play a role. Conditions like cystic fibrosis or chronic lung disease, which involve a lot of coughing, can increase the risk. Lastly, previous rectal surgery can sometimes weaken the tissues in the area. These factors can all contribute to the development of anal prolapse. Anal prolapse often comes with some pretty telltale signs. A visible bulge protruding from the anus, especially when straining, is one of the most obvious. Rectal bleeding, mucus discharge, and fecal incontinence are other red flags. Discomfort, itching, irritation, and a feeling of fullness or pressure in the rectum are common. Pain during bowel movements and difficulty passing stool or chronic constipation can also occur. If you're experiencing any of these symptoms, see a doctor for a proper diagnosis and treatment options. How do we figure out if it's actually anal prolapse? It starts with a trip to the doctor. They'll take a thorough medical history and perform a physical exam. A digital rectal exam is usually the next step. Depending on the situation, additional tests like defecography, colonoscopy, or sigmoidoscopy might be recommended. Anal manometry might be used to measure the pressure and function of the anal sphincter muscles. These tests help confirm the diagnosis and rule out other conditions. Now for the good news, anal prolapse is treatable. The best approach depends on the severity of your condition. For mild cases, non-surgical options might be enough to manage symptoms. This could include dietary changes, stool softeners, and pelvic floor exercises. Biofeedback therapy can teach you how to better control those muscles. For moderate to severe cases, surgery is often the most effective solution. Procedures like rectopexy or resection rectopexy can be done laparoscopically, minimizing recovery time. Surgical techniques have advanced significantly, making these procedures more effective and less invasive. So there you have it, a crash course on anal prolapse. Early diagnosis and treatment are crucial for preventing complications and improving your quality of life. If you're experiencing any symptoms, don't hesitate to reach out to your healthcare provider. Thanks for watching, and until next time, stay healthy.